4 student, semester 8. I am a medical student. Today we will perform the lumbar puncture on the patient. So first of all, to perform the lumbar puncture, we should take the consent of the patient, because we have to insert the needle in the patient. So we should ask the patient if the patient is comfortable with the insertion of the needle or not. So it is necessary to take the consent of the patient. So next we have to do the preparation step. For the preparation step, what we should have the all the equipment which are being used for the lumbar puncture. First of all, we have the sterile syringe. We should have that, and we have the LP needle. We call it the lumbar puncture needle. We have the forceps, and we have the tubes to collect the CSF. We should also have the antiseptics. We should have the cottons. We should have the bandages and the cotton balls. So here what we should do here, we should you see the patient and the position of the patient. Like we can see here, the patient is in the lateral decubitus position. So for the insertion of the lumbar puncture needle, we should see the site of the insertion. For that, we know the site of insertion for the lumbar puncture is the L3 and the L4. So how can we find the L3 and the L4? We should draw an imaginary line from the posterior superior iliac crest from both the sides, like this, from the upper side as well as from the lower side. So the point of intersection where they will meet, we will palpate that position here. So this is our side. So now what we should do, we should clean that where we found the insertion of the lumbar puncture. We should clean that side. For that, we will take the forceps. We will take the cotton ball. And we will use the antiseptic to clean that. To clean this side, we should use from center to the periphery like this, and we should repeat this procedure 3 times. But for 3 times, we should use the 3 different cotton balls. So the next step is we will use the anesthetics like this. After doing the anesthetics, we should wait for 5-10 minutes so that we wait for the anesthetic will act. Now the next step is we will insert the lumbar puncture needle where we found the site. So we will do it like this. And we should try it slowly, gently. As we can see, 2/3 of the needle is inserted. So we should open this knob and collect the CSF. For the collection of CSF, we should keep the tubes ready. So we can see here, CSF is coming out. So we collected the CSF in 3 different tubes, and we will apply the knob again. And slowly and gently we will remove the needle. And we should use the bandage, or we can see. We can use the bandage or the cotton pads to cover this insertion. So after that, we will send these CSF to the laboratory for the diagnosis. That's all our procedure is done. Thanks.